Hello, I'm Susan Stanley. I'm a registered nurse and I direct health services for Emory and Henry College. We're located in the health center, which is with the Emory Internal Medicine office, 2 offices in 1 building. We're in the village. We're between the Emory United States Post Office and McPherson Center. This year we've made a couple of changes related to COVID and pandemic world. One of those is that we're seeing folks by appointment only. So we have to have a scheduled appointment to see folks. There are several ways that you can do that. On the website, when you go to College Health Center, you can find the scheduling tab. There's a Calendly link that has some telehealth appointments where I can visit with you on a telehealth platform. You can call the main health center number, which is 276-944-6219. Or you can send me an email. If you need to get through during our operating hours and it's pretty important, probably best to call. Make sure that you leave your name and your telephone number where you can be reached in case we're not available to pick up the phone at the time that you call. Our student hours have changed for our doctor and nurse practitioner. This kind of goes along with class schedules in terms of making it easier for you to make appointments. So they're seeing folks on Mondays and Thursdays from 3 until 4:30, and on Tuesdays and Wednesdays from 10 until 11:30. The health center's open Monday through Thursday from 8:30 to 5 and Friday from 8:30 to 2. I want to talk to you about a couple of things specifically related to COVID. The importance of wearing your mask and wearing your mask properly. Mitigation efforts to keep this virus from spreading, are the major tool that we have to help each other stay safe and be able to stay on campus together. Wearing your mask, covering your nose and your mouth, making sure that you have a good seal is very important. If you're wearing a cloth mask, we ask that you wash those after 1 day of wearing or after the mask becomes visibly soiled or wet in any way, then it's not effective. So we want to make sure that you are washing those. It is important that everyone have their face covering on at all times. The policies are written out. The respiratory aspect of this virus is what makes it spread so easily. Respiratory droplets. Those can be from talking, laughing, singing at any point. So the mask is what is preventing those respiratory droplets from spreading and therefore preventing the virus from spreading. This virus has a reproductive number of over 2. And what that means is if I am diagnosed with COVID and I share that because I'm not following the social distancing or I'm not wearing my mask with one other person, then that shares with 2 people. 2 people shares with 4, 4 with 8, and before you know it, just from one person, 16 people have been infected. So we need to slow the reproductive number of the virus, and that means we have to protect each other. Another thing I want to talk to you about is symptoms. You're receiving a daily COVID-19 check in your email. We are asking that you complete this every day. It asks for, have you had fever? Have you had cough? Have you had other symptoms like nausea, vomiting, diarrhea? Have you had a runny nose, a sore throat? Go through that checklist every day. There are triggers on that checklist that if you answer a certain way, the health center is going to get an email that has your email address. We're not getting the answers to your question, but we'll reach out to you to find out, is there some way that we can be helpful? Or have you actually monitored? Did you actually check your temperature and realize that you have a fever this morning? We can then give you instructions on the best way to proceed if you have those symptoms. A lot of people, this time of year in particular, have allergies. Most folks know if they're sneezing a lot, this is related to my allergy symptom. If you take your allergy medicine, it gets better, then you know pretty much that's related to allergies. Most of the time you don't have a fever when you're having allergy symptoms. But if something's not working for you and you have any question at all, we would rather you reach out, talk with us, and we'll make a plan for what we need to do in terms of whether you need to be actually seen in the health center or not. One of the other questions is about COVID testing. We are not actually doing COVID testing in this building. We have community partners that we have partnered with for testing. All the testing in our local area is currently drive-through testing. We have a number of places and folks that we have partnered with in terms of testing. You do need to be tested if you're having symptoms that can't be attributed to another illness or can't be resolved by being seen. So let me give you an example. You wake up and your throat is really, really scratchy and your temperature is above 100. You're going to call us or contact us. I'm either going to visit with you on the Doxy platform or talk with you on the phone. We're going to make a specific plan. Let's say that we've set an appointment time and you come into the health center. We take a look, get all your vital signs, and realize, ooh, that really looks like strep throat. We're going to test you for strep throat. If that comes back positive, we're going to prescribe the medication that you need to help get over that. At that point, we would not send you for COVID testing. But let's say that strep test comes back negative, and we can't decide that there's any other cause of the symptoms you're having. We would have you get a COVID test. The cdc.gov site has a lot of very helpful information. It is the best place to go to get accurate information. Our return to campus plan is based strongly on the CDC guidelines. So that's a great site that you can go and get additional information. One other word about testing. Testing is only a snapshot in time. Testing tells, do you have the illness right now? You could be tested and be negative, and 2 days later start having symptoms that you weren't having and be positive. So testing is a snapshot in time. It's important. We will grow in testing capabilities and the types of testing that are available, but for now we are partnering with our community partners for testing. I want to speak just a minute about isolation and quarantine. Isolation is when you yourself have been diagnosed with COVID. Quarantine is when you have been exposed to somebody who has been diagnosed positive, or you're having symptoms and you're watching to see, do those symptoms worsen or change, or do you develop illness? In quarantine, if you develop illness, then you yourself need to be tested. And that might mean that you would then go to isolation. But I just wanted to make clear the difference in those two terms, that isolation would be a person who is positive for COVID-19 illness, and quarantine would be watching for the symptoms, watching to see if you develop symptoms that cause you need to be tested for COVID. The face-to-face exposure time, the importance of physical distancing, is that the virus can spread very, very rapidly. And so if you are face-to-face without your mask, talking with someone for more than 15 minutes, especially in an enclosed area, your risk is very, very great, especially if the person happens to be an asymptomatic carrier, if they happen to not have a visible fever or a known cough or other symptoms related to COVID, they could be a carrier. So this is another reason that we all need to enforce the physical distancing, wearing our mask, washing our hands frequently with soap and water. There are stations all across campus that have hand sanitizer. Soap and water is the best first choice. Hand sanitizer is available when soap and water are not. For instance, entering and exiting buildings when you've had to open a doorknob or push a button for an elevator or walk up and down a staircase. Hand sanitizer is located and available for you to use, and we want you to make sure that you're doing that. Our hands can transmit the germs very easily. So there are just a few other tips in addition to wearing your mask properly, washing your hands, and social distancing. You want to be careful when you're handling your contact lenses. You want to make sure that you've washed your hands thoroughly, and you want to make sure that you're changing your contacts according to their directions, whether they're extended wear or daily wear. You want to make sure that you're not eating or drinking after another person. You want to store your toothbrush in a toothbrush holder. Don't just leave it out on the sink. Just a few extra tips in terms of making sure that you're keeping all your devices clean. You're going to be using your cell phone, your computer, your earbuds, or earphones a whole lot. Just make sure that you're following manufacturer's directions for cleaning those, either with an alcohol solution or an antibacterial solution, and helping to prevent spread of germs that way. I'm really glad that I was able to talk with you for a few minutes. If you have questions, I want you to make sure that you reach out to us. We're here to hopefully help everyone in the efforts of all of us to stay strong and safe together.